I'm Priscilla Campos, and today I'm going to be conducting a newborn assessment on my patient. Prior to going to the room, I'm going to be checking the patient's birth history and previous vitals. I'm going to knock on the door, provide privacy for my patient, wash my hands, introduce myself to the mom, pretend there's a mom, and acknowledge the baby as well. Hi, baby. I'm going to talk to the mom. Hi, I'm Priscilla Campos. I'll be your student nurse today. I'm going to be doing a newborn assessment for your baby, if that's all right with you. Mom will say yeah. I'm going to ask her to verify the baby's name and date of birth. So Mariah Lee is the baby's name, born 8/24/24. And I'll verify that and make sure that's correct, which it is correct, so we got the right baby. And I'm going to be asking if I can touch the baby. Yes, that's fine. You can touch the baby. I'm going to make sure the baby's safety rails are up for the baby, so she's not at risk. I'm going to unwrap the baby, check the baby's temperature and the axillary, and I'm going to listen to the baby's heart rate at the apical in between both of the nipples right in the center. I'm going to be listening to the baby's heart rate for 1 minute, starting now. Alright, I note that the baby's heart rate is 120 beats per minute. I'm going to put my hand over the baby's stomach and chest to feel the rise and fall. I'm going to listen to it for 1 minute, starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 58, 59, and 60. Alright, so I got 60 respiration rates for my respiration rate, so that's how many breaths per minute the baby was breathing. Cover the baby back up, keep the baby warm. Actually, before I do that, I'm going to note the baby's general appearance. I don't know any general diagnosis at any part of the body. I note that the body's aligned and symmetrical. Good muscle tone. Baby's got a good strong cry when it was born. And the skin is intact. Good color. And I'm going to check for any vernix, which I do note vernix in the baby's crevices, a little bit of mealy on the top of the baby's nose, no petechiae noted. I'm going to turn my baby around as well and check for any Mongolian blue spots, which I don't see any Mongolian spots, and I don't know any petechiae as well either, and I'm going to be checking for any lingula, any hair on the baby, so I do note some here, and the back of the hair of the baby, excuse me. And I don't know any arrhythmia, toxica, I think that's the word. I think it's how you pronounce it. So I don't know any of that either. So that's good. Okay, I'm gonna cover the baby back up. Maybe it doesn't get cold. And I'm going to check the baby's head. So I'm checking for the posterior fontanelle of the baby, which is intact, and the interior fontanelle, which will seem good. And then I'm going to be checking for any modeling. It came from the birth canal, so I note some modeling. Nosophiliac hematoma noted on either side, and no capta. I would also, after checking my temperature and vitals for the baby, I would check the baby's head circumference, so starting from the back all the way to the top of the eyebrow. I check the baby's length from the top of the head to the end of the toes. Chest circumference from the bottom of the baby to the top of the baby, of the chest. Put the baby back up. And I'm going to now check the baby's eyes. So in this baby doll, I have to hold the baby's eyes up. I don't know if you really have to do that with a normal human baby, but for purposes, I'm going to do it like this. So I'm going to use my pen light, check the baby's irises and pupils. Alright, so I know that the conjunctiva is intact for the baby. The eyes are symmetrical. I don't know any strabismus. The baby's pupils measure out to be 3 millimeters. The iris color of the baby is gray, and eyes are symmetrical, conjunctiva. No strabismus noted. Any abrasions or anything on the eye. Next, I'm going to be checking that the ears are well formed. So you kind of go symmetrical to the tip, the ears, top of the ears to the end of the eye. Same for the eyes to the ear. Well formed, aligned, and intact. Note some vernix around the ear. And check the baby's nose. You're checking for a baby's nasal patency bilaterally, which I note is good. Next, I'm checking the baby's mouth. You're going to go with the gloved finger and to check your baby's hard and soft palate to make sure it's intact. So that's what I'm going to do. Baby's soft palate and hard palate is in fact intact. I don't know any Epstein pearls inside of the baby's mouth. I'm looking inside of the baby's mouth at the roof or anything. I will assess sucking and swallowing when the baby is feeding. However, for this purpose, I will just put my finger here and the baby will be sucking and swallowing is intact. Noted during mom's feed as well. Next, I'm going to unwrap the baby. Check the baby's neck is intact. Baby's clavicles are in fact intact in both bilaterally. Excuse me. Next, I'm going to be checking the baby's chest. So she's got equal chest rise and fall, a good symmetrical chest, a good alignment of the chest, good shape. I'm going to be checking the baby's breast and noting if the nipples have any swelling or any drainage, which I don't note. I'm going to be listening to the baby's breath sounds. Left to right. And flip the baby over, listen to the baby's back with the breath sounds. Good breath sounds, note a little bit of crackle, but it's normal because the baby was just born. That's good. I'm going to also listen to the heart sounds at the apical again, just to see if I know any murmur. Okay, no murmur is noted. Baby's got a good expansion of the chest. No abnormalities noted in the chest region. I'm going to move to the abdomen. Umbilical cord still intact. Umbilical cord has two arteries and one vein. And I'm going to look and make sure that the abdomen is symmetrical, and it is. It's appropriate in all quadrants. I'm going to auscultate. Baby is probably not going to have any bowel sounds currently because the baby hasn't had its first feed yet. So I'm just going to listen to the sounds on each 4 quadrants. Don't know any bowel sounds. No bowel palpitate seating bowel. No any distension in the bowel. No, I don't know any. The baby has had its first void since it's been born, and her first poop meconium. So we're all good. I'm gonna check the baby's vaginal area. The baby does have 2 labias covering the clitoris, so that is intact. I don't know any vaginal discharge in the baby. So all that is intact. I'm going to flip the baby over, check the baby's vertebrae, palpate the vertebrae, any openings in the vertebrae, which I don't note. Check the anus patency of the baby. Just put your finger here, make sure the muscles tense up, which that is intact for the baby as well. I'm going to move to the extremities of the baby. I know good muscle tone and strength in each extremity. They're both equal. The arms and feet and legs are both equally bilaterally. They've got good movement. I'm going to check for hip dislocation. I don't hear any popping sound. So no hip dislocation noted. Range of motion. Maybe it has range of motion intact. And things of that nature. Make sure all 10 toes are intact. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5 is intact. 5, 10 toes intact. So 10 fingers are intact as well. I don't know any bowing in the legs or any abnormalities in the baby's hands, feet, or legs. Next, I'm going to check for the baby's palmar reflexes. Good, intact. The baby's planar reflexes. Good, so the baby will bend the toe down on each of them, so it's equal bilaterally. Babinski, their toes will spread out, so when you rub the bottom of the foot, spread out. So Babinski reflexes are intact bilaterally. You're going to check the tonic neck. So I'm trying the baby's head this way, baby's arms should go up, this should go out. Turn the baby this way, arms go up. So that's normal, both intact. Rooting, so I'll rub the baby's face, the baby will turn to whichever side. I'm turning to sucking and swallowing was intact when mom was feeding. And then I'm going to do the thoracic, give me 1 second, the gelatin, so the vertebrae curvature, whatever. So it's basically where you just rub here and the baby's reflex will be to lean in towards that side. Okay, so that's both intact bilaterally. Perfect. Cover the baby up. The baby is now sleeping, lightly sleeping, because the baby just fell asleep. Wrap the baby up to be warm again. And before coming into the room, when I was going to check for the birth history, you're going to obtain your APGAR and things of that nature for the baby. So the baby's tonic neck was intact as well. Didn't mention that. I don't know if I said the name, but I did. And then I forgot to do one more thing. The marrow of the baby, Mahler, I think. So you put the baby's hands up and you drop them, or I think Miss Week said you can go like this and put the baby back, and the baby will get startled and cry, so that reflex is also intact. So that's it for the baby's checkup. So thank you, Mom, for your time. Thank you for letting me work with your baby. Is there anything else I can do for you? No, thank you. Okay, make sure the bed rails are up for the baby. That I wash my hands and I document.